I said I wanted to be a physical therapist, and I was very focused on that goal. Most of you, especially the high school students here, don't think too much about the mail anymore, the actual snail mail. But I can tell you that one of the most important pieces of mail that I ever received in my life was when I got my letter saying I was accepted into PT school at St. Scholastica. So I can still tell you exactly what I was doing on that day when the mail came. So I am a physical therapist, have been a physical therapist for over 25 years. When I was a practicing physical therapist, before I went over to the dark side of administration, I worked with children. And the nice thing about working with children is you have some choices on where you are going to go to work every day. For many years, I worked for the Superior School System. And so every day I went to school and worked side by side with the teachers and other students on taking care of kids with disabilities in the district. Very fun, very exciting. At that same time, when school would get out at 3 o'clock, I would go to the hospital in Superior. And then I would see kids from a more medically based model and spend the rest of my days seeing children there. So I think one of the nice things about being a physical therapist, and I also will add that being an occupational therapist or a speech language pathologist are also very good careers to think about. When you become a therapist, any of those three that I just mentioned, you really can subspecialize. You could choose to work in nursing homes, hospitals, school districts. I know some physical therapists who actually work for athletic teams. You know, the Packers, the Vikings, they all have physical therapists that work as part of their teams. The options are just endless. OTs also actually can do a lot with businesses in terms of occupational medicine. And so what I liked was that there would always be a variety. If I got tired of working in the hospital, I would have the choice to work in a clinic or work in a school district. Along with choosing where you work, you also get a different population of patients. So again, are little people your thing, or do you want to work in geriatrics? A lot of flexibility, and that was really one of the things that appealed to me in going into the therapy field. Most of the time when people need therapists, it's because something has happened. Nobody decides usually just to see a therapist for fun. There's typically a problem. Either there's been a sports injury, somebody's had a stroke, heaven forbid, something really terrible has happened and you've been in a car accident with multiple problems going on. But oftentimes therapists are seeing patients and families when they are dealing with life-changing events. And so what the therapist then is focusing on is restoring function. And to me, I found it to be extremely rewarding to work with patients when they started here, and after weeks, sometimes months, they ended up at a completely different level of independence. And really, you had the opportunity to form some lasting relationships with those patients and those families. In terms of the job market, let me tell you a few little things about that. When we have an open therapy position here, we are pretty happy if we have maybe 3 candidates that we have to choose from. It is not like many fields right now where you have a job opening and perhaps you have 200 people apply for one job opening. We're celebrating if we have a field of 3 or 4 people, therapists, to choose from. We have some positions out in our rural hospitals where we have recruited for a physical therapist for 2 years. And so again, if you are looking for a position where you want to be sure you're going to have a job after graduation when you've got all those school loans to start paying back, again, a therapist could be a really good option for you. So again, it's a very exciting time for you as you ponder the next steps as you go forward. Wish you well on that journey, and I'm hopeful that you'll consider rehab as a possibility for you.